Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk to you a little bit this morning about what pressure can do to the dental arches. It'll surprise you what just a slight pressure can move the teeth and move the whole jawbone and everything. It's amazing. Just a constant slight pressure, and there's a reaction, and the teeth will change to this wherever this pressure is going. And it's hard to think of the various pressures that are on the teeth. Every time you swallow, if you swallow correctly, you push your tongue out like this, and you bite your teeth together, and your tongue forms the palate and puts the torque in the teeth and does all these things with very slight pressure. And a lot of times we don't think about this pressure, but I had a case back real early when I first started getting into right after I just quit doing any kind of general dentistry in 1970, and in 1971 this happened to me, and I'm going to go through this case again. This young man came to me, and the picture is pretty sorry here, but you can see him, and he wanted braces, and he only had was a deep bite, and I kind of was hesitant to start him, but he insisted on that, so we started out, and we just put some bands on his 6-year molar teeth, and back then we banded his lower anterior teeth and his upper anterior teeth, the 6 teeth in each area, and I put these 2 little arch wires on there, and these arch wires had pressure, and we had the upper arch wires picking the upper teeth up, the lower one was taking the lower ones down, and they were working off of the 6-year molars. We'll show that later on. Let me go back here. All right, here's where the bite started. I mean, it was deep. It was a deep bite, but he had nearly a class 1 relationship and some crowding, not too much on there, but you can hardly see the lower anterior teeth here. I mean, the bite is deep, and so we wanted to open this bite, and what we're trying to do is just to push these up, and the lower teeth we're going to just push them down, and that's basically what we were going to do for the young man. And so we put this very simple appliance into his mouth and sent him off, and I may have seen him one time, I'm not sure, but when he was biting, he may have bitten on these brackets that helped open it some to start with, but this is back when we banded everybody, and you remember these teeth right here were down here at one time. Now all the teeth in this, the teeth in this area rose up, and the teeth here went down, and the only thing was in there were those 2 little arch wires. One of them went up like this, and one of them went down like this, and I tied them to the teeth, and they were pushing on the teeth, and this young man didn't come back. I mean, I put this stuff in, and we didn't see him again. It was 6 months later. The young man came in, and one of the ladies came back to me and says, Dr. Wyatt, this young man is here, and she gave me his name and everything. And I said, well, let's take a look at him and put him in the chair. So she brought him in and put him in the chair, and I went in there, And I was amazed, you know. Look where those teeth had gone to. Now, people have done a lot of research in orthodontics and bone structure and all kind of things like that. It is actually, if you took two perfectly teeth that were in the same amount of bone and everything, and you tried to lower one by raising the other one out, it would be 4 times harder to push the tooth down into bone than it would be to exfoliate the tooth. In other words, this one would move 4 times while this one just moved once. And this is what happened here. All right, we have intruded all these teeth across here. I mean, these have gone down and these have gone up, and it worked off of the 6-year molars back here in the back of the mouth. And how did this happen? And so let me go back and see if we can get this picture. Now here you see the laterals are down too, and the cuspids are down. This whole thing right across here and here, this went up and this went down, and we were working off of 6-year molars, 4 molar teeth back here in the back, provided the force for this to happen. Now, if you have one force going one direction, you will always have another force going the other direction. That'll be the same thing, absolutely the same thing. So there was this much pressure on the upper 6-year molar over here, for it was pushing these teeth up, and that same pressure was pushing down on that 6-year molar. Now you just have to believe that, but that's the engineering and everything tells you. I mean, if you got something going one direction, you will have something else going the other direction. Now, the lower ones, we were going down with them. I mean, there's all these teeth over here. That's teeth, bone, and all. You didn't bury these teeth up into the bone. The bone moved with the teeth. All right? Here we've got the lower 6-year molar, and it's pushing all of this down, but it's trying to push it up. And now the upper one is pushing these up, but it's being pushed down. So we've got these 2 molars back in the back of the mouth on each side that are being pushed together while we do this. All right, this young man chewed good. I mean, he swallowed properly. He bit his teeth together every time he swallowed. He apparently breathed through his nose, and he kept his mouth shut, and he had pressure on this all the time. Now, how did that happen? Let's go look back here now. I'm going to say, let's go to look at the side of the mouth if we can. All right, here are the 2 6-year molars. These are being pushed down as this is being pushed up over here. And there's 6 teeth over here. It didn't raise the cuspid much, but it did pick it up some. And down on the bottom, the same thing. And this molar right here is pushing these teeth down, but it's being pushed up. And this is going up and this is going down, and we're butting the 2 teeth together right in here. And some smart guy came along later, a lot smarter than I am, and he figured, well, if I put something on this tooth right here and go out here and put elastics on it, it can pull this into a class 1 relationship and really won't change that very much because this doesn't move much back in the back. And I didn't capitalize on that, but I did capitalize on one thing. I looked at that and I said, this is amazing. I mean, we got this much movement and had very little back here to pay for it. In other words, when these teeth came together, how did this happen? How did this happen? Why didn't it just shove these teeth down this way when you're pushing this up? It's a lot easier to exfoliate than it is to intrude teeth. But yet, the teeth that would have been exfoliated didn't move hardly at all. Nothing, very little movement there. So this came to me that if I can do that, then I can put something over here and I can put a lot of force on this and I can open anybody's bite. And we learned how to do the intruding arch there on top of the other arches, and we have not found one single person that we couldn't open their bite. I didn't care if they were 75 years old or 80 or something. I've never gotten into a 90-year-old, but I think you could open them. And that force right in there has little effect on those molars, provided the person is swallowing correctly. And you bite about a couple thousand times a day, or you swallow, and you should be biting your teeth together for a normal swallow. And just the chewing effect and the pressure, the muscles up here pushing this and this together, don't let this move hardly at all while this whole thing up here opened up. And I've had that happen on just all kinds of deep bite cases. I've taken cases you wouldn't think you could open them. You just put that on there and it'll open them up. Now, so this slight pressure on a constant deal, and the pressure back in here may not be so slight. The guy's chewing, and he may be chewing harder than we think, but there was almost no movement of those teeth. Here it is, a close-up of that, and you can see the teeth push the mesial down. In other words, the distal of the molar wasn't hitting much, but right up here on the mesial part of the molar, in other words, the pressure actually, you just draw this and you pull down and you're trying to prise this down so it's going to go in this direction. So the mesial part of the molar hit. Now down here, we got this, we pull it up, you put it down, it's pushing up, so the mesial part of this molar is go up over here. And there's very little movement in those teeth. Now, we transfer this knowledge back to orthodontics. It doesn't take a ton of force to do something, and things can happen that you don't even realize it. I had a gentleman, a very nice guy, he's about 45 years old, came in to me and he said, "Dr. Wyatt, my bite has opened in the last year or so, and I can't get my teeth together." And his upper teeth were pushed up, and I had wear facets where they had been touched back here, but the teeth were up. And I sat there with him and talked for him for quite a while. I was getting behind, and I left and went to work on another patient. And the lady that was in the room with him talked to him some, and he said, "Well, said I tried to stop smoking, so I've been taking these lozenges and putting them up in the roof of my mouth here and pushing them, holding them up there with my tongue." And just that was what moved all these teeth, bone and all. I mean, you don't move the teeth out there without the bone going out there. Now, if the guy had been sucking his thumb or playing a clarinet and twisting or smoking a pipe and pulling down on it or doing anything to put force up there, he could have moved those teeth, bone and all. And the teeth go where there is no bone, they carry the bone with them, and that doesn't seem to have dawned on people doing dental work. They think, if I've got to move some teeth out here, I've got to operate on them and move the whole deal over. I don't know. I can take the teeth and move them over to the side, and the bone that's with the teeth goes with the teeth when they do that. And this man had moved all those front teeth up there by just putting the tongue in there and pressing on that slightly with that, move this 40-year-old man's front teeth out there. I've had other people for years. I've seen the bicuspids and a little bit of the cuspid, but the cuspid's real strong, didn't go in, so they'd have a little depression in the teeth on the sides here. And I could not figure out, you can't do your muscles and make them go there. But one night I woke up in the night and I had a vacuum in my mouth. If you got a seal and you swallow 2 or 3 times, you create a vacuum in here, and the vacuum pressure pushed these teeth in on people. Just that slight pressure moves the teeth that way. So we've got that to think of. Now let's go ahead and we'll just touch up here. But this young man, this was in 1971, and this has been a long time, and that's when I started using this intruding arch wire, and we've opened everybody's bite. I don't care anything. If you got ankylosed teeth now, you'd have to break them loose, but we've been able to take people who's biting the roof of the mouth and open the bite up like that. So this is just something I want to go along, and I hope you realize this happens. And here we took a guy that was like that, and we opened that bite, and you can see the lower front teeth. I think I've got a picture here showing them inside. At least I thought I did. Yeah, there we go. All right, there's a picture. His lower front teeth, when he came in, were just virtually biting the tissue right up here in the mouth. Now, if you could take a picture of it after it's out, this is down and this is up, and these teeth right here provided the force to pick these up and these down, open the guy's bite. And why do people in the United States, or the modern people, have such deep bites? Let me go back here and erase that. Why do we have such deep bites? I tell you, if parents turn their kids loose and let them gnaw a few bones and do things like that, I mean, I go and see somebody eating a piece of chicken and cutting the meat off the bone. Take the thing and bite on it. You know, if we bit with our front teeth more and used them more, we wouldn't have all these deep bites in here, and we wouldn't have near as much orthodontics to do. But I'm going to shut up. This was 1971 when we did this, and you see it's on the models. I've got these models, and I'm going to try to get a place where you can come look at these things if you want to. But anyway, thank you for watching, and hope you get something from this. Watch what happens to your patients when you work on them, and follow them for years and see how it happens. It doesn't take much in the way of force going in the wrong direction to make the teeth crooked and do things to them that we do not want them to have. So thank you again for watching, and I hope you join our group and subscribe to our channel, and I'll see you later, hopefully. Bye-bye.